Hi everybody, welcome back. It's Amanda Ridout, health coach, and we're back with our favorite pharmacist, Ben Fuchs, also cosmetic chemist and nutritionist. And Ben, how are you doing?
I'm doing great, and it's good to see you. And I'm glad glad to do another video with you. How long's it been?
It's been,
6 months. I bet it's been 6 months, 5 months maybe.
no, maybe not that much, but it seems like a lot.
No, because I moved 4 months ago, and
Oh,
we haven't done one since before I moved. Well, before I moved, it's been 5 or 6 months.
oh, wow. Well, sorry everybody, we're back now, and we're going to try to make it so that not that much time passes by. But in these months, something has happened, something new,
Yes,
and
I gave
you,
birth. I gave birth.
you
I
gave birth to
yes.
Blemish Repair
I
Complex.
gave birth to a new product, and it's like a child to me. I love my formulations. I'm very
Oh,
attached to my formulations. So Blemish Repair Complex is something I've wanted to do for a long time. As you know, acne, skin issues in
yeah,
general, eczema, psoriasis, acne, etc. They're kind of a passion of mine.
yes.
And partially it's because I love biochemistry, and the biochemistry from a cold scientific perspective, the biochemistry is just super fascinating. And then also I'm a therapist, and I know that I can help people. Skin diseases are unlike any other health challenge in that everybody sees it. It's psychologically debilitating as well as physiologically debilitating. In fact, it's not even as physiologically debilitating as it is
Right.
psychologically debilitating at times. So it's near and dear to my heart. I found tremendous benefits from nutritional supplement with nutritional supplements for skin health challenges. Tremendous, almost curative. I don't like the word cure because really what we're talking about is reversing things. Now, it's not only a supplement issue, but it's in large part a supplement and a dietary issue.
Yeah.
I always talk about the four dimensions of healing. There's the spiritual, mental, and emotional. I always am hesitant to use nutrition in a curative way, because you got to address all the elements of health. But
Yes.
that having been said, I've seen tremendous skin improvements in skin health challenges using supplements and dietary strategies, elimination diet, probiotics, good bacteria. I've seen it for decades, for 30 years. And so I know I can almost guarantee you're going to notice results, and I can almost guarantee you're going to notice dramatic results. In fact, I can guarantee if you do it right, you're going to notice results.
Wow.
But I can almost guarantee you're going to notice dramatic results depending on all the factors that are involved. There's different
Right.
factors. It may take you a while to nail it down, but you'll notice results. For the most part, because most skin health challenges have a large component of nutritional deficiency, acne included. Okay, all of them, eczema, psoriasis, rosacea, all of them. Rosacea is not a skin issue, but be that as it may, you can do a lot with nutrition and acne. And I've always sent people to health food stores for various components. Go get yourself vitamin A, go get yourself selenium, go get yourself NAC, go get yourself the B complex, niacin, etc. So what I decided to do was put it all together in one product. And that's the Blemish
Oh,
Repair Complex. So you
so
don't have to go.
this is a
You don't have
supplement. It's not a topical product.
Correct. It's a nutritional supplement. I suppose we should have said that.
Wonderful.
This is really what I love to do. I love the skin,
Yeah.
but you don't need a lot of skin products.
Right.
You only need a few skin products. But nutrition is a little bit different in that everybody has specific needs, although most people need the basics. I will say
Right.
that. And one of the beautiful things about my Blemish Repair Complex is you don't have to have acne to benefit from it. It's great for your liver. It's great for a detox. It's great for as a way of getting high concentrations or high dosages, I should say, of very important vitamins. So let's talk about some of them.
Yeah.
One in particular, which we talked about in the past for acne, is vitamin B5, pantothenic acid.
Okay. Yes.
Pantothenic acid it's an underappreciated superstar of vitamins for a lot of reasons. For women's hormones, for the manufacturing of steroid hormones, for helping the body utilize fats, for people going on the ketogenic diet. It plays a very important role in the fatty part of the body. Acne, in many ways, is a manifestation of disruptions in fat metabolism at the cell level. This causes secretion of sebum. Actually, first it causes distortion of the cells. Acne is caused directly. I mean, there's reasons why this happens, so I don't want to
Right.
say it's caused, but right before the blemish happens, you have a distortion of the fatty membrane of the outside part of a skin cell. That distortion triggers a whole bunch of chemistry. It triggers a whole bunch of inflammatory chemistry, and that's really one of the core features of a pimple, of a breakout. Is the fat is the membrane.
Okay.
That's why vitamin A is so important, by the way, and that's another nutrient that's in the Blemish repair complex. We'll talk about that in a second. But vitamin B5 plays a very important role in the fatty part of the body. It also helps the body make fats that thin sebum. Sebum's the skin oil, and when people have acne, they have thicker skin sebum. Okay. That thick sebum clogs pores. That thick sebum stays on the surface of the skin. That thick sebum can give the skin a shiny, oily appearance. Vitamin B5 plays a very valuable role in helping the body process fats and helping the body thin sebum via fat processing, so you don't get that shiny look. You get less sebum being produced, and the sebum tends to be less likely to clog pores. So vitamin B5, but you need high doses. That's the secret with vitamin B5. You'll find it everywhere. In fact, it's called pantothenic acid. That's the name of it. Pan means everywhere. So pantothenic acid is found everywhere, but not in the high concentrations that you need to get effect. So I put 1,000 milligrams of vitamin B5 in this product. That's a huge amount. Huge amount.
Wow.
I think the RDA is 10 or 15 milligrams. And you need that kind of quantity to really have a benefit. That alone is worth the price of admission, just the vitamin B5 content. But that's in a context of the entire B complex, including niacin. There's some people will get the niacin flush. So if you're worried about the niacin flush, you want to take this with food. Although it hasn't happened. I've heard a couple people say they get the niacin flush, but that can happen. Niacin is the second most important vitamin for the skin, especially for acne. In fact, the signs of niacin deficiency, one of the major signs of niacin deficiency is rashes on the skin, redness on the skin. Down south, famously, they used to eat a lot of corn, which was deficient in niacin, and they would get red necks when they worked out in the sun.
The rednecks.
That's where they get the term. That's where they get the name redneck. Exactly. So then there's a bunch of vitamin A. Again, a high concentration of vitamin A. Vitamin A is important for the health of the outside part of a cell. Vitamin A helps cells divide at just the right rate. That's why vitamin A is used for cancer. Vitamin A is actually chemotherapy for cancer because it stabilizes things. It's a stabilizing vitamin. Right. In the business, we call it a normalizing vitamin. It normalizes the growth of cells. And again, there's a big dose of vitamin A there. But of course, that makes it important for your eyes. That makes it important for your liver. That makes it important for your bones. That makes it important for your menopausal symptoms. If you're dealing with menopausal symptoms, there's a whole wide range of benefits that you get when you supplement like this. Okay, so you're getting a big dose of vitamin A. You're getting a big dose of vitamin B5. You're getting niacin. There's also a big dose of zinc. So zinc is one of the two most important nutrients for acne-prone skin are vitamin A and zinc. Those are the two most. Vitamin B5 is up there, but not quite to the same extent as vitamin A and zinc. Both vitamin A and zinc work hand in hand. They work together. They're both anabolic, building vitamins. They help the body build. Vitamin A is a building vitamin. Zinc is a building mineral. Zinc deficiency is very common, and zinc deficiency is associated with problems with the male hormone system. That's why zinc is good for male reproductive reasons, for fertility, and for sexual performance, and for the immune system. Zinc's phenomenally important. Yeah. There's 50 milligrams a day of zinc. There's a huge amount of zinc in there as well. Zinc picolinate in the preferred form of zinc. So just with the zinc, the B5, and the vitamin A, you've got yourself a mega supplement. But there's more. Wow. There's also vitamin E in a specialized form that allows it to penetrate into the cells more effectively, a high-tech form of vitamin E called vitamin E succinate. And then there is my favorite non-essential. What's my favorite non-essential nutrient? You probably heard me talk about this. NAC.
Okay, yes.
NAC.
Yes.
That's my favorite non-essential nutrient. And also selenium. Selenium and NAC work together.
Okay.
Selenium and NAC, as a matter of fact, selenium, NAC, and vitamin E all work together. Now, NAC is absolutely amazing for all detox. I'm talking if you're drinking alcohol, it helps prevent hangovers, or it helps mitigate hangovers after you have a hangover. And by the way, this whole complex is a detox complex. The Blemish repair complex. This whole pill is a detox pill. So if you're doing prescription drugs or illegal drugs, if you're drinking alcohol, if you're abusing your body in any way, this is a detox supplement as well. And that's one of the neat things about nutritional supplements as opposed to prescription drugs. With a prescription drug, you're never going to get these kinds of multiple benefits. This is why nutrition is such a powerful healing modality compared to drugs, even though we're all, as a culture, perhaps not people listening to this video, as a culture, we're hoodwinked into believing drugs are really the way to get through therapy, or the way to do therapy, and that nutrients are alternative or supportive. But it's the drugs that do the heavy lifting. It's actually the nutrients that do it. But because they're so subtle, because the actions are so subtle, they're not as like hitting your head over. It's like the difference between carving with a fine scalpel or hitting something with a hammer. It's a fine-tuned way of working, and sometimes the results are subtle, but they're always there. If you are deficient in nutrients, and almost everybody is, especially these nutrients, you will notice results guaranteed, and pretty quickly, within less than a week, or within less than 2 weeks, but usually within less than a week, and dramatic results to the extent that you correct other things that are going on in your life. If there's food allergies or food intolerances, or you're eating a lot of sugar, something like that.
Okay, so we already know, or most of us are familiar with your other products, and those are the topical products. Is there one specific that goes hand in hand with this complex?
No, that's a great question. If you have acne, of course, my 5% retinol is a preferred topical. But the other ones are important also, because they're nutrient. Remember, the way I look at formulations is like supplementing for your skin.
Right.
As important as supplements are internally, the beautiful thing about the skin is if you know how to formulate a product correctly and you understand activity, you can supplement the skin topically as well. And this is important for two reasons. Number one, because you're putting the supplement right on the area, it's going right to work.
Okay.
But number two, and this is really underappreciated and very important, when you are nutritionally deficient in vitamin A, you're not getting enough vitamin A in the diet, you're not supplementing, or your body's using a lot of vitamin A, or when you're nutritionally deficient in vitamin C, your body will rob it from the skin. And you will become deficient in the skin, because to the body, under deficiency states, under shortage states, it's reallocating the supplements, the vitamin C that would be stored in the skin for growing connective tissue and making skin cells divide correctly and stabilizing the metabolism of fats, etc. It doesn't consider that as important as the liver. It doesn't consider that as important as secretion of digestive juices, which these are the things that vitamin A does. It doesn't think the vitamin A or the skin is as important as the bone or the liver or the digestive system or the spleen or the other internal organs that are vitamin A dependent. So you can, under deficiency states, you can assure, it's like an insurance policy, that your skin is getting those nutrients. So number one, you notice quick results because you're putting the nutrients right on the skin.
Right.
And number two, and number three, or number two, you're preventing this robbing effect, this reallocating effect. But number three, and this is really very important, and we don't talk about this enough, putting stuff on your skin is inherently wrong. Your skin doesn't want to have stuff put on it. So if you're going to put something on your skin to exploit its healing properties, be careful what you're putting on, okay? You get your average product, you're going to get crap that you wouldn't want to touch, let alone rub on your skin if you saw it at the laboratory. And I know because I was there. I used to wear masks for some of those. For the preservatives, I'd wear gloves. I'd wear plastic gloves and go in with a mask.
And then we smear it all over us.
Yes.
And on our babies and everything.
I know. And nobody talks about this. And you don't think this is going to cumulative have an effect? Of course it is. It can't help but have an effect. Oh, but there's no studies. You don't need studies. It's just common sense. Preservatives are cytotoxic. That means they kill cells. They're toxic to cells. Cyto means cell. Toxic means toxic, poisonous. Preservatives are by their nature cytotoxic because they kill cells. That's how they work.
Right. They
kill bacteria.
Right.
What's a bacteria? A cell. If something kills bacterial cells, it's killing your cells too.
Right.
Now they'll tell you, this is the dogma that I got, it's just 0.1%. It's just 0.01%. Yeah, but you're doing it over and over and over. It's cumulative.
I'm excited to really try this product.
I'm excited for you to try it.
Is there anything else you want to share with us?
You take 2 to 3 a day. I like people to take it with food. You can take it on an empty stomach. It's a good idea to take with food. You want those digestive juices going. But you can't take it on an empty stomach. You can take all 3 at once, or you could take one 3 times a day. I recommend 3 times a day. Some people are doing twice a day. And I think that's it. That's all I want to say. Blemish Repair Complex is what the product is called. And you find out all about it at truthtreatments.com, truthtreatments.com.
Wonderful. Well, thank you so much, Ben. We will be seeing you again soon. And thank you, everybody, for watching. And hopefully this was helpful to you and for your skin health. Bye.
Bye.